Welcome to today's muscle anatomy question series, and this is day 4. So let's get right into the question. A patient presents with a laceration to the wrist. So laceration to the wrist tells you the location of the injury, right? 2 months later, I notice their thumb lies in flat with the other fingers. The thumb lies in flat. A healthy thumb is 90 degrees to the palm, right? So if the thumb lies in flat with other fingers, it means that a nerve has been affected. In fact, if it is lying in flat, there are some nerves that are intact, like the ulnar nerve, which causes adduction, and the extensor of the radial nerve. The extensor, which is caused by radial nerve, is also intact. But it means something has occurred, which is the medial nerve. That's what I'm suspecting. Now, a fleshly bulge at the base of the thumb has wasted away. The thenar eminence has 3 muscles there, and the muscles there is the OAF muscles. We have the Opponens pollicis, we have the Adductor Pollicis brevis, and we have the Flexor Pollicis brevis. These are the 3 muscles that are at the thenar eminence, and these muscles are supplied by the recurrent branch of the medial nerve. Right, the recurrent branch of the medial nerve. So it means that these things have been affected. The patient cannot touch their thumb to their little finger. So let's just go right into the question. Now, touching your thumb to your little finger is called opposition, and which is caused by Opponens pollicis. Opponens pollicis. And the Opponens pollicis is what causes opposition of the thumb. So the answer is actually B, obviously. But let's know why the other options are wrong. We have the adduction of the thumb. Adduction of the thumb is actually caused by the Adductor Pollicis, right? And the Adductor Pollicis is innervated by the deep branch of the ulnar nerve. Okay, so that can be the answer, because this is a medial nerve injury because of the thenar eminence. So we also have opposition of the thumb. Opposition of the thumb is what is obviously the answer, because it is caused by the Pollicis brevis, Opponens pollicis, and the Opponens pollicis is part of the muscles in the thenar eminence, supplied by the recurrent branch of the medial nerve. We have extension of the thumb. Extension of the thumb is done by this muscle, the extensor pollicis longus. Extensor pollicis longus, right? And it is innervated by the posterior interosseius branch of the radial nerve, right? The posterior interosseius branch of the radial nerve. So that can be the answer, because first of all, extension is occurring because that nerve is not affected. The flexion of the distal thumb joint. Now, this one particularly, all right, it is caused by the flexor pollicis longus, which is different from brevis. Brevis is a short, longus is long, so they are 2 different things. Okay, now this flexor pollicis brevis is already supplied before laceration of the muscle has occurred. Okay, it's already supplied, so the nerve has supplied the muscle first before the laceration can occur. Laceration occur after the nerve has supplied the FPL, that's the flexor pollicis longus, right? And the nerve actually affecting this actually the anterior interosseius branch of the medial nerve. Okay, so the answer obviously is opposition to the thumb, which is caused by the Opponens pollicis, which is part of the thenar eminence. All right, so look at the thenar muscles here. So the thenar muscles, we have the Opponens pollicis muscle, Adductor pollicis muscle or brevis, right? And then that's the flexor pollicis brevis muscles, and the Adductor pollicis brevis muscle, and this is the Adductor pollicis muscle. So first of all, the 3 muscles there is your OAF muscles, these 3 muscles here. Okay, so these are the muscles that are affected when you cannot, majorly when you can put your finger across or carries it up. Okay, so the answer majorly is your opposition to the thumb, right? So that's the answer. Okay, so that'll be all for this series. All right, see you tomorrow.